Hey everyone, welcome to the Living Rightsized Podcast, where we talk about simplifying, downsizing, and living with intention. I'm your host, Joey Sampaga, here to share stories and expert tips to help you live right-sized at any season of life. Now, I would like to welcome our special guest today, Bobbie Boyd. She is a hospice educator with Heart of Healing Hospice. Now today, Bobbie and I are going to discuss palliative and hospice services. Then we're going to talk about some hospice myths that are out there, that are lingering out there, that Bobbie's going to bust these myths. Welcome, Bobbie. How you doing?
Very good. Thank you so much for having me, and I'm grateful for this opportunity you're providing that we can share some really good information and bust some of those myths.
Absolutely. Well, Bobbie, you're all dressed up and ready to go to work, it looks like. And, the information that you're going to share today is going to be amazing. And, our audience is certainly going to learn something.
Very good. I hope so. That's what I'm here to do, is to educate.
All right. Well, let's start off with an easy question. What inspired you to start working in this specific field?
Well, thank you for asking. It's actually very personal to me. I was a caregiver for my mom during her journey, and I found that I didn't know anything. I didn't know anything about healthcare, and we were literally making decisions every time in a crisis setting. And then I also found that there were a lot of people in healthcare that really weren't helpful and really weren't able to guide me through this journey. And so now I've found, since then, I've learned quite a bit, and I've found that it can really make a difference. I always say, I wish I had me now then. So I think I'm just here to share information and help people with what the resources are that are out there that might really make a difference in this really difficult journey that they're on.
Okay. Well, I wanted to ask you now, I'm a little familiar with palliative, at least the term palliative and palliative services, only because I'm familiar with chaplain positions. But I'd like to ask you on, the medical side of things, what are palliative services?
That's a good question. And a lot of people have trouble even saying the word. It is a service covered by insurance. And it is what's considered to be a curative service. And by that, I mean it's for someone that has a serious illness, but they have questions and they want answers and they want cures. They want treatment. So they're wanting the option of being able to go to the hospital. They're wanting the option of being able to go to the urgent care. They want to have surgeries. They want to regularly see their primary care doctor. They want to regularly see specialists. And they want to get all that information together to try to feel better and get cured. But that's a lot. So that's where the palliative services can come in. I'm paraphrasing a little, but the word palliative basically means better communication among your healthcare team. And that's what this nurse does by touching base on a monthly basis, trying to help this person navigate that healthcare system and get the most out of it and provide support for their family. The good part about medicine nowadays is it's become very specialized. The little downside of that is one doctor will treat your left finger and one will treat your right, and they aren't necessarily communicating. So that's what this palliative nurse does, is fills in those gaps. Or sometimes you'll go into a doctor's appointment and so much is discussed, you can't carry all that information out with you. So it's hard to describe specifically what that service is because it's very unique to each patient, but it's a lot of education. Review of medications. Are they taking medications correctly? Some medications you should eat with food, others not. Some pills shouldn't be cut in half. And are all the medications working well together so there aren't adverse reactions? Also, for these kinds of people, it's very hard to get out. So this nurse can order mobile services like mobile podiatry, mobile blood labs, mobile x-ray. She can make a referral to a specialist. So she's just an extra support system, again, to help this family and this patient navigate the difficult healthcare system as they're trying to get answers and get cured and feel better.
Okay. So you mentioned curative. So does that mean that these services are provided to help them get over whatever they're going through and hopefully whatever medications or any type of therapy that's required is going to help cure whatever they have. Is that
Right.
what I mean?
That's exactly it. They're wanting to be cured. If they have cancer, they're doing the chemo, they're doing the radiation, they're getting surgeries, and they're seeing all these specialists so they can get better and they can get cured. That's the goal. And that's where the palliative nurse can come in and really make sure they're getting the most out of all those treatments and curative measures that they're trying.
Okay. And then with these palliative services, is that something where they have to go into the hospital, or do they get visited at home? How does that typically work?
Yeah. The nurse touch bases in a home setting once a month. And so again, recognizing this is a lot they're dealing with, the more care that can come into the home and support that, the better. Absolutely.
Okay. And then with these services, I mean, who would be the best, best patient for this type of service?
Well, that's a good question. Really, any patient that has a serious illness, this would be your cancer, your heart failure, your any of the kidney diseases, any of a very serious illness type. And this service, like I said, is covered by insurance. You check that your company is in that insurance network, and that service can continue as long as you're struggling with that disease. So there's no real end to it. As long as you feel it's helpful for you, insurance will continue to cover that.
Okay. And then is there an age limit or an age requirement?
No, there really isn't. We personally specialize in adults and seniors, but this service is available for, different companies specialize in different palliative services. Our particular company does focus on the senior community.
Got it. Well, yeah, and with Living Rightsized, of course, we're also focused on seniors.
Right.
And, of course, that's why we have you here to mention all these types of services and what they are, because not everyone knows what palliative services are. Mm-hmm. And now with that said, I mean, now we're going to talk about hospice. Now, most people, when they hear the word hospice, right, they think they're getting towards the end of their life. It's where they typically go to, rest in peace, I guess, if you want to say it in a way, right? So what exactly are hospice services?
And thank you for asking the question, because I've had people that have said from the beginning of the conversation, no, I don't need hospice. We're not at end of life. He's not dying now. So this is a wonderful opportunity to just give you information and explain what it is and what it isn't. Everyone who has Medicare has a portion of Medicare put aside for hospice. It's use it or lose it. And we were previously discussing people with serious illnesses and looking at the curative and the palliative services. This is where someone has a serious illness and they've tried chemo and radiation. Maybe they're not even a surgical candidate anymore. The treatments that they're trying aren't working and maybe are making them not feel well. And maybe there aren't any more questions they have or answers available. They've taken that curative as far as they can, and maybe they aren't really wanting to go to the hospital anymore. And they start to think, how do I want to spend my life? In the hospital and with treatments and trying to pursue this disease further, or do I want to focus a little bit more? It's a mental change of mindset where you start thinking more in terms of comfort care and quality of life. I want to spend my time with my family. I want to be in my home. And that's where you start to consider hospice services. Now, all the services that I'm going to mention are covered by that Medicare portion that's put aside by everyone that has Medicare. So we have a doctor, a medical director that would oversee everyone's care. This would include a nurse visit, a nurse aide visit for bathing, showering, dressing, a chaplain support for spiritual support that can respect any kind of denomination or just visit as a friend, and a social worker that can provide any kinds of resources. All this team comes into the home. Now, a lot of people think that hospice is for end of life, but research shows, and if you think about it, you have an entire medical team whose only purpose is to ask you what's important to you in life, what are your goals, and how can we support that? Now, to cover Medicare on this service, You do have to have a serious illness. You do have to be moving towards end of life. But like I say to people, we all are, and none of us know exactly when that's going to be. So as long as you have a life-limiting disease, if the disease were to progress in the normal progression, you would have a 6-month lifespan. And so as long as that insurance qualification is met, hospice really has nothing to do with end of life. It's that support team coming into the home. And research shows people live longer because you have that team focusing on you and your quality of life. One of the big aspects of hospice is you don't have to go to the hospital anymore. So we become your 911 for minor or major questions. So at 2:00 in the morning, if you're not on hospice and your loved one has a really bad headache, you're going to be sitting there going, well, I hate to go to the hospital. It's not that bad. Can we wait till the morning till we can get in to see our doctor? With hospice, our nurse is on call. You call her 2:00 in the morning. She answers the phone and gives you medical advice. If it's serious, she comes out at 2:00 in the morning. We're on call for you 24/7. So you don't have to wrestle with, is this major enough to even try if I can get my loved one in the car to go to the hospital? So that's a huge benefit of this service. And along those same lines, those phone calls and those visits, your questions are answered. So we've seen people just have such a sense of relief that their family doesn't have to struggle with all of these medical decisions. And we release you from that so that you can spend quality time as a family rather than a caregiver. Now, those visits from nurses can become daily. They're usually about 30 to 45 minutes, total head to toe vitals. We specialize in pain control. How are you doing? Is your family supported? But if you start to decline, again, those visits can become daily. If you feel better, then those visits can go back to a couple days a week. The thing about hospice is we're there for you to hold your hand through the whole journey. But sometimes we find people do better on hospice. I've seen this happen, and we're able to graduate them off and put them on palliative. So there's always that option. Former President Carter was on hospice for 2 years. So there's a real misconception that this has to be for end of life. It might be, we don't know, but you've got that support system. Now, Medicare also covers all of the medical equipment. We can usually get that in by the next day. That's a hospital bed, a bedside commode, a wheelchair, a walker, a shower riser. All of this is delivered to your home, whatever you consider to be your home. It might be a residence, it might be a group home, it might be assisted living, and you might move to one of those or use a service like yours, Joey, to help downsize. The team will go with you wherever you go. And we also cover all medications under the hospice diagnosis, and things like wipes and gloves and Depends and under bedside liners. All that's provided and delivered directly to your home. So it's really a great service when you're at the point that you start thinking, rather than the curative, maybe I want comfort and quality of life.
I'm sure that most people, well, I don't want to say most people, some people, like before I truly understood what hospice was or is, I always thought hospice was in a facility. I wasn't aware that it was also home care as well. It can be done at home, where they would feel a lot more comfortable because, who wouldn't feel much more comfortable in a home, in their own home or a family member's home versus, a facility, for instance. With hospice staff or hospice employees, if they're getting into the hospice career, they have to kind of have the heart for people, right? I mean, do you find that that's the way it normally is, or are they just...
That's the way it should be. Everyone will tell you in any field of healthcare that they provide the same services. So basically all hospices provide the same services that I was telling you about. But you really want to look for who has the heart. This is actually the third hospice I've worked with, because if you tell me you want me to help you with hospice, I feel that on my shoulders. That's trust. And I want to know the team, and that team has to respect the trust that you're placing on me. So we have people transferring to our hospice from other hospices in tears because no one will answer the phone or a nurse is too busy to come out. So that's something you really want to look for. As I explained, this is personal to me. My mom was on hospice. I know what that's like. And our team members I've seen in action, and they feel that way. So yes, one would hope that if you're choosing to go into this field, and there are some of the people I know in hospice and on my team just are the biggest hearts. I just say they're a walking heart. They're just such a loving, caring person. And that's ideally what you want.
No, and that's definitely great to hear. And, when my mom was in the hospital back in 2012 before she passed away, we did have different nurses. Some you could tell really cared. Some were just there. Now, of course, we don't know what their day was like or if they're,
Right.
going through struggles themselves, but you can feel the ones who really cared and the ones who were just there waiting to go home.
Right.
So it's always good to know that, you guys, your company seems to be very, very caring, it sounds like.
They are. And I feel like I would have them treat me and care for me. And I feel like they would treat anyone like a family. And I've seen it. I know each of them, and I've seen them and how they care. So I feel comfortable with that very much because, again, I feel that trust.
Sure. And now, is there a limit to how long someone can stay in hospice? I mean, you said that, of course, the goal, or not goal, but we're hoping that they would graduate to the palliative care, right?
Right.
But is there like a limit of how long someone can be in hospice?
That's a really good question. Theoretically, there isn't. We are required, every hospice is required periodically to document that the hospice care is, and the Medicare paying for that is justified. Now, very rarely does someone do a downward slope like this. It's usually they decline, they might stabilize. It depends on what disease you're dealing with. They decline a little, they stabilize. So it's okay to remain on hospice if you're stabilizing for a little bit, but we need to continue to document that there is a decline, things like weight loss or falls or things like that justify legitimately that Medicare coverage because it is so comprehensive. As long as we can justify that there is a decline and the need for us to be there, you can stay on hospice theoretically as long as you would like. But again, we have to have that continuing decline. And like I mentioned, former President Carter we have people that can be on for like 2 years and graduate to palliative. And we're very careful with that transition so that they are transitioned to that service. But so after a point in time, they're going to either have passed away or probably graduate to palliative.
Got it. Now, if there are family members who really don't know which way to go, like, does my loved one need palliative care or hospice services? I mean, how do they determine that? Is that typically done through a one-on-one or an appointment with a counselor?
Yeah, that's why I'm called an educator, because people ask me that, is it palliative better or hospice? And they go through that decision. And the other question is, what am I looking for? When are they ready for hospice? So again, the big difference between palliative and hospice is the mindset, more so than the disease state. The disease state might be well advanced and you may still want palliative. That's your personal choice. That's one thing that's beautiful about the hospice and palliative systems is you're in the driver's seat. You make those decisions. But the decision between palliative and hospice is, am I still wanting to go to the hospital? Am I still wanting answers? Am I still wanting treatment? If you're not at that point, then it's a mindset where you start to think, do I want comfort? How do I want to spend my time? Do I want to spend my time at home with my family and not be going to the hospital? So that's kind of the decision there. As far as hospice and when that's right, we love coming in early. Again, having personal experience with going from crisis to crisis with my mother and having to make a decision and gather information and make a decision in a crisis setting, you don't want to do that. I love just sitting down and explaining what hospice is. And then you may say, I'm not ready for it now, but now you know what it is. So, and you're not having to think that through. And lots of times you want to talk to family members, you want to talk to the patient. It's a big decision. And so it gives you the time. So we would have a nurse come out and do an evaluation, and we welcome the chance for you to think about it. We could come back later in a couple weeks or a month. We're here for you. We can move as quickly or as slowly as you'd like.
Okay. Well, that makes sense. So it sounds like as an educator, you're one of the first people that they speak with. Is that
Right,
right?
right, right. Yeah. So they have the information again, and we get rid of the myths we're going to bust later on so that they can make an informed decision.
Okay. Well, that makes sense. And yeah, that's a lot of information on palliative and hospice services. Now, I want to jump into some of the hospice myths that are out there. And I know that there are some questions you were going to ask me, and you know, I don't know what the answers are, so we'll see what happens.
Good, good. And I wanted to start that with just saying that so often I am asked to have the hospice discussion, but don't use that word. And I can think of a woman where we had this long conversation, and at the end she's about services. And at the end she said, "That sounds wonderful. I'm really surprised I've never heard of that." And so at that point I felt comfortable saying, "Well, you might have. It's also called hospice." Really? Really? So I love the chance to just kind of bust some of these myths and misconceptions that people have. So see what you think. So the first one, you tell me what you think, true or false. Going on hospice is giving up, true or false?
Well, based off of what you told me and what we just learned, I would say false.
That's correct. It's exactly the opposite. It's like being referred to a specialist, like being referred to a cardiologist. We special in that end of life decline, pain management, keeping you out of the hospital. And like I said, I've seen people actually come back to life on hospice. I had a gentleman, when we put him on hospice, he looked pale and declined. And I visited with him a couple weeks after he'd been on hospice, and his cheeks were rosy and he was animated, and he'd been talking about the kids had taken him out to Father's Day. And I looked at he and his wife and I said, "What happened?" And she said, "Love of family and hospice." So it is not giving up on you at all. It is absolutely positively keeping you in mind and doing the best we can for you. So question number 2, you're doing okay so far.
All right.
The hospice benefit provided by Medicare is for 6 months only. True or false?
Oh, I asked that question, so I'm going to say false for that one.
You are very correct. And like we said, as long as we can document the need, then the Medicare coverage continues. And if we find we can't document the need, then we just graduate you onto palliative services. Okay, you're doing pretty well. Let's see.
Yes, I feel good. I feel good. What's the next one?
Okay, you go off all medications when you go on hospice. True or false?
I would have to say false on that one.
Yep, you are absolutely correct. And I have a lot of people thinking we just take you off everything. We don't. We want you to be comfortable. So first of all, our nurse will review all of the medications. Sometimes we had a gentleman urgently go out and put him on hospice because his blood pressure had crashed low. And we put him on hospice, and the nurse reviewed his medications and said, "You're on 2 medications that lower your blood pressure."
Oh, wow.
Oh, really? So we review all the medications. Again, you're in the driver's seat. You tell us if you want to keep taking them or not, but we'll let you know risks and benefits and whether we feel like those can really help you or not and give you guidance on that. We'll treat a UTI. If you have a urinary tract infection, we put you on antibiotics for that. If you have pneumonia, we probably give you about the same treatment that the hospital does. So if you get the flu, we take care of that. Anything. We're just not going to put you in the hospital. We're not going to put you through a surgery. We're not going to do anything radical and drastic, but definitely we're going to keep you on your medications, keep you comfortable.
Good to know.
You're doing really good.
I am.
Now, okay, true or false, you go on hospice to die?
What I learned today is false.
Because you kind of started the introduction with that. That's
right.
what people think. And like I told you, I've had people that at the beginning of the conversation said, no, not hospice. He's not at end of life. Now we have people, I actually was blessed to spend Christmas Eve in the hospital, and we were able to get a family to come into the hospital and put the mother on hospice, discharged home to spend Christmas the next day with her family. Oh. And she passed peacefully the following day, but the family had that memory. So often it is people's dying wish to come home, and be comfortable. So absolutely, we're there to help them all the way.
Oh,
all right. Awesome. One more here.
Okay.
True or false? Hospice hastens end of life. True or false?
False.
That's correct too. A lot of people think that, we're going to be doing something that's going to advance your end of life. Absolutely not. Absolutely not. And like I said, I've seen people just come back to life on hospice, and we're doing everything possible to keep you safe and comfortable. And our whole team is dedicated to that. So definitely people tend to live longer. We have no control over that. We're just the support and the care system. All right. You're doing very well. We have one last question.
All right.
True or false? This is a tricky one. You need a doctor's order or referral to be referred to hospice services.
Oh, gosh. I don't know. I'm going to just guess on this one and say true.
It's false. We finally got you on one. Sorry. That's still a very good score, I have to say. But no, a lot of people think, and that's a very common question, that their doctor has to refer them. Now, lots of times people have a good rapport with their doctor, and the doctor will discuss hospice with them and make that recommendation or make that referral. But you, again, you're in the driver's seat. If you want hospice, you contact someone like me, and we can put that in place for you. We do like to get your medical records release form so that we can get your allergies and your medical history from your doctor. But you make that decision on your own, and you can self-refer. So very good, though, I have to say. Very, very good.
Oh, good.
Yeah,
Yes. I definitely learned a lot from that, Bobbie. Thank you so much. So after our conversation, it sounds like not all hospice services are the same. What should someone look for in hospice service?
And that's a good question. We talked about that a little before. Not all hospices are mandated to be accredited. It's a good idea to see that the hospice has been accredited by one of the national accrediting organizations. That means that they have met or surpassed the national quality standards of care. But the other thing I think that's really important is the heart. Make sure you're feeling the heart of the person you're speaking with. You're interviewing them. You are able to meet with their nurses, the hospice educator, and really get a feel for the reason they're doing this. I don't work on a bonus or commission. I think our team is the only one that doesn't. We're here to provide information. We're not to sell you something. You want to be very careful. And you don't want someone that's going to rush you. You want someone, because sometimes you're in the hospital and someone will really feel like you've got to make a quick decision. You take your time to make that decision when you're comfortable. So I think the heart of the organization, making sure they're accredited and listening to what they say and trusting your own heart in making that decision.
Got it. No, this is amazing information, Bobbie. I appreciate your time of actually taking the time to do this podcast with me, because there are a lot of people out there who need this type of education or at least information. And of course, if they have more questions or want more information, we'll have your contact information in the show notes. But before we jump into the quickfire round, where we can have some fun, was there anything else that you wanted to mention about hospice or palliative that we didn't get to cover yet?
Thank you. I'd just like to say, if someone is interested in hospice services, they would want to talk to someone like me with a hospice to get the education. If you want to proceed, then the next step is a hospice evaluation. The nurse will come out and do a head-to-toe assessment, vitals, make sure that the family and the patient themselves understand what hospice services are, and then decide as a family and with our hospice and our medical director, if the timing's good, that this is going to be a service that really is going to help you. If that's agreed upon and you want to start the services, you sign some paperwork and they start immediately. But like I said before, we never mind coming out, having that discussion, and we can continue it and come back again and again at your convenience.
All right. Perfect. Okay, let's go ahead and get to the quick fire round. And we're just here to have some fun. I didn't prep you on any of these questions.
No,
so here we go. First one. If you had to eat one meal every day for the rest of your life, what would that be?
Anyone who knows me knows the answer to this: pizza. I can eat it cold for breakfast and warm at night. I'm pizza all the way.
You go.
That was an easy one.
Yeah, okay. How about this one? What's the weirdest job that you've ever had or almost had?
Oh, goodness. Well, I've had a lot of jobs. I'm trying to think of the strangest one. Probably just house cleaning, and I had to pick Play-Doh out of the carpet. I don't know how weird that was, but that was
pretty
challenging.
weird.
That was challenging. I do have to say that was a challenging experience.
Okay,
Most
perfect.
of my other jobs have been pretty normal after that.
Okay, got it. Okay, how about this one? I know that people know that you love pizza, but what's one thing people would be surprised to learn about you?
And that's an easy one too. Very few people know. And when they learn this, they're very surprised that I love zombie apocalypse and The Walking Dead. And I actually wanted to try out for the zombie school. So
really,
now everybody knows that about me. But yeah.
So you've been practicing your walk.
Oh, don't ask me to do it. I will.
No, that's amazing. Okay, so with our listeners, Bobbie, how can they connect with you best? Is it your website? We'll have your contact information in the show notes, of course. But what would you prefer? How would you prefer to be contacted?
Call me on my phone. It's 480-292-0583. I'm here. I know lots of times people work. You can call me in the evening. I know these things don't happen at convenient times. You can call me on weekends. I'm here to help because I just know, again, I wish I'd had me then, it can make a difference. And that's what I'm here for. So we do have a website, and that gives a lot of information, but I'm available to personally answer questions because this is a big personal decision.
Sure it is. Absolutely. Well, Bobbie, thank you so much for joining us and educating us about palliative and palliative care and hospice services. It's information that needs to be heard and to be shared, because not everybody likes to talk about it. But now that the myths are busted that hospice isn't for the people who are end of life or about to die, I mean, it's information that brings a new light. At least for me, it does with hospice services, and I'm sure it does for our viewers here. If you have any questions for Bobbie, her contact information again is in the show notes. We'd love to hear your comments. Please post them in the comments section. And if you found this information valuable, please do us a favor. Subscribe to the channel and like this video. And if you know anyone who could use this helpful information, please pass it on. Bobbie, again, thank you so much. We appreciate you. Until next time, have an amazing day. Take care and God bless. Bye now. Bobbie, that was awesome. Thank you.
Thank you. It just, that was so special. And you made it easy for me just to be able to talk and cover good points. You did very well on the Mythbuster.
Well, I was listening, but did I miss I missed the last one because did you mention anything about that?
No, I didn't. That's why I told you it's kind of a trick question because it comes up a lot. But I thought I'm making this too easy for you because I covered a lot of stuff. So I can keep you on your toes.